Yeah, we'll see. The #1 complaint about ADHD, that it is overdiagnosed. So many parents blame pharmaceutical companies for pushing parents into medical regimes for their active kids, medication.
Right. What do you think about this? Some people say, oh, that kid doesn't have ADHD. Their parents are just not patient, just popping pills, having them pop pills.
How about just a quick test to find out if they have it?
Well, there is a doctor in our area who's trying to do something like that. Let's go to Jen. She's live in Huntingdon Valley. Good morning to you, Jen.
Good morning, and just so you know where we are, we're at the Philmont Guidance Center. Dr. Dan Hartman, good morning to you.
Good morning.
And we have young Gavin here, who's he's just on his best behavior. You're going to test him at some point this morning.
That's true.
Okay, so let's talk about this. I mean, you know this. We talked on the phone yesterday. You know that when I put this on my Facebook page, the #1 complaint was, these doctors are just trying to give him medicine. They're trying to overdiagnose him. You don't run away from that idea. Instead, you agree with it and say this is a better way to get these kids tested.
One of the difficulties with ADHD is that there's this very subjective quality to a child's behavior. At what point does a little bit of rambunctiousness become an ADHD diagnosis? This test allows us to very objectively measure focus, concentration, and the ability to control impulses.
And so we talked about this. So any kind of mental condition, basically, if you go to the doctor textbooks, there's like 3 or 4 different things that the diagnosis would contain. Symptoms or just things that you have.
Correct.
So instead of saying, he's kind of hyper, he's kind of this tests it and then compares him, like let's say he's a 6-year-old like Gavin, to other 6-year-olds all around the country.
That's correct. And then we use the data that we obtained from the Quotient system and compare that with the clinical data that we get from teachers and from parents, and that allows us to more accurately diagnose the condition.
And I have a 6-year-old boy, and by the way, Gavin's sitting much better than my 6-year-old boy would ever sit. And it can be difficult to try to talk to them in a clinical or a doctor environment. I mean, you don't know if that's the guy that they are in school. You don't know if that's the guy that they are at the dinner table. I'm sure that was a difficulty for you in years past.
That is correct. And this takes away much of the indecision involved with the diagnosis of the disorder.
Okay, so then once you get the readout, does it then help you treat him better?
What it allows us to do is to measure how well someone can focus and concentrate and inhibit movement. We can then decide what treatment is used for the child, whether it's holistic intervention or behavior therapy or standard medications. The point with this is we can then track the improvement that occurs. That's what we've not been able to do accurately in the past.
The other thing that we talked about is you said sometimes the kids are anxious, they're depressed. There's a lot of kids that get weeded out from a traditional ADHD diagnosis because of this.
That's very true. I've had a number of children present with this complicated picture of difficulty with impulse control and feeling depressed and anxious, and it's often difficult to tease those symptoms apart from each other and know which is causing what. And I've been able to run some of those children on the quotient test, find that they have perfect attention and concentration, and then address the depression and anxiety without using standard medicine for ADHD.
Okay, so because of HIPAA and all kinds of things, we want to be really open about who this little guy is. Basically, he's the grandson of someone who works in your office.
That is correct.
Yeah, but he hasn't been tested before.
He has never been tested before.
And does the person who works here say, oh, my little guy's crazy, or he's a little... I mean, I think everyone thinks their 6-year-old boy... I mean, at least mine is can be rambunctious from now and then.
He can be a little rambunctious at times.
Okay, but we're going to see if it's true 6-year-old boy or if there might be a need for a little bit of extra help.
We're going to run a test, and we'll take a look at that test and see what it shows.
Okay, Gavin, you ready for this? Okay, so coming up in the next hour, we will have run it, and then we'll show you a little bit about the test. Pretty cool stuff. I mean,
it's important
Chanel
stuff,
and
too.
Mike. Yeah, and you both met Brody, and there are some days where I'm like, who is this kid? Why is he so crazy? Then you look it up on the internet, and it says, quite frankly, that he's fine, but then you never know. So it's a 15-minute test, covered by insurance in most cases.
In some cases, yes.
Okay,
He's gonna
and
get
so
some
we'll talk
calls
about
then.
what we find.
Okay, I've taken a test of this young man, and I determined that he's very cute.
You said hi. You stuck
He's
your tongue out
adorable.
at you. Thank you,
All right, we'll
Jen.
test him in just a little bit. 7:38. Need some bread, man?